I am here with Dr. Michelle Haggerty this morning. Take it away for us.
Hi, nice to meet everyone. I am a family physician. I'm triple boarded in family medicine, integrative medicine, and lactation and breastfeeding medicine, which is a new board certification for physicians. I am a mom to three rambunctious boys, 7, 4.5, and 2. And yeah, I'm an individual. So I'm an entrepreneur. I'm a adventurer. I'm a chocolate lover, all the fun things. And I own fourth trimester doc, which is a in-home private practice providing fourth trimester and lactation support in the home for people postpartum. So for the maternal or mother side, birthers and their newborns.
Love it. So we're talking mastitis today. I contacted Dr. Haggerty because I knew that she does lactation support and some support around mastitis, but I feel like there tends to be a lot of misinformation or what do you do when you have it? And the stuff that I used to know is maybe not accurate anymore. So let's jump into it. First of all, can you tell us first you get clogged ducts, then you get mastitis. Tell us that progression, what we're looking for symptoms when we're real okay, we got to take action now kind of thing.
Yeah. So there's definitely sort of spectrum. And I guess I'm back up, but just a little bit to talk about what is plugged ducts and mastitis, and so we can get some background anatomy and sort of physiology around it to really understand. And that makes more sense as to how we manage it then moving forward. So we used to think, so classically, we used to think that mastitis and clogged ducts were sort of milk that was backed up into the system. So kind of like a tube of toothpaste, where the toothpaste is sort of clogged, and then you have to sort of squeeze it out and try and get it out. And once you get the clog out, and everything starts to flow. And that is not how it works. And so this is sort of a whole shift in the lactation world, and it's really sort of upended all the things that we were doing previously. So previously we would do things like massage extensively to try to get the plugged milk out. We would do things use a vibrator and try and vibrate it, or vibrating toothbrush. We would go in the hot shower and try and massage it out. We would have our partners suck as hard as they can to try to suck the clog out, right? Or use a haka with the Epsom salt and put that on there and try and suck it out. All of these things are not indicated and do not work, and is not the way that we manage clogged ducts anymore. And the reason is because clogged ducts is actually not a really great term for it either. It's narrowing of the ducts. So there's inflammation around the ducts themselves that are sort of squeezing the ducts closed. So you sort of think about it like construction on a freeway, where the lanes are sort of closed down, and so everything's sort of having to go through a narrowed passage, basically. So when we're thinking about and it's not this backup of milk. It's not clog of milk that's just like a big clog that's sitting there. So when we're thinking about that, then the inflammation and the tissue around the ducts sort of closing in, and the ductules kind of having this narrowing, then all those things that we just talked about can actually be harmful then, right? Because you're increasing the inflammation. If we're massaging onto an area that has inflammation, if we're putting a vibrator onto an area that has inflammation, or trying to suck out really hard, trying to pull those cars through so narrow passage, you're going to cause more damage. And that's when things that's when we go more into things like mastitis or abscesses, or things like that, where we're causing more damage to the actual breast tissue around the ductules. So what we want to do is decrease the inflammation. So how do we do that? We think about it as a sprained ankle, for example. So when we sprain our ankles, we still use it. We still walk and do things like that, but we don't run a marathon on it, right? So we don't want to increase the production on that side. So we also hear about that. Empty. Make sure you're feeding, frequently on that side. No, you don't want to be doing that. You want to feed just as much as a baby would need otherwise. You want to limit the amount of pumping. So pumping is an artificial way of sort of pulling the milk from the breast. So that causes inflammation. So we want to decrease that and try and feed directly as much as possible. So maybe you have to take off work or stay home or whatever, if you're sort of in postpartum a little bit later than in postpartum time. And or post, post the initial postpartum, I should say. And so yeah, so you want to be sort of, very direct feeding for the baby. And then the other things that you want to, the other things that we do sort of like with a sprained ankle is we would take ibuprofen, for example, or non-steroidal anti-inflammatory. So ibuprofen or naproxen or something like that to try to bring down the inflammation. I also really like turmeric or curcumin supplements as an anti-inflammatory. We have studies that show that it's equivalent as far as bringing down inflammation. And so yeah, so you just want to be feeding directly. You just want to be bringing down that inflammation with supplements or herbs, and then or with ibuprofen, and then also you want to ice it. So using ice directly on that area to sort of bring down that inflammation, just like we would with a sprained ankle. So again, we do not do things that sort of increase that inflammation with causing direct damage to the breast tissue. The breasts themselves are glands, right? So it's similar to like the thyroid gland or the pancreas. These are two very and all three of them are actually very, very fragile sort of systems or organs in the body. And so we would never put a vibrator on your thyroid. We would never massage the pancreas, right? Like we wouldn't do those things because it would cause damage. So we have to treat the breast the same way. It's not, people, I think, treat it similar to like a muscle where they're like trying to, massage and do things like that. But that's not what you want to be doing. You want to be allowing that it to sort of rest. And yeah, so those are some of the major things. I will say that, I've had my own narrow ducts in the past, and there's this like drive to want to actually massage. Like there's this physical drive being like, I got to get out of, and so, you have to do things that sort of take that mind away from doing that. So doing things like going for a walk or exercising or, talking to friends or whatever you need to do to try and get your mind away from feeling like you have to touch and move and do the things to try to feel like you have to move things through.
Mm-hmm. Fair. What about, how do we not get here in the first place? How do we prevent the narrow ducts?
Yeah, right, exactly. So for most people, if you are feeding directly and you are making milk, the amount of milk that the baby needs, and the baby's removing the milk that you're making directly, and you're not doing anything additional. So no additional pumping or no additional sort of like storing of the milk or doing things like that, then the likelihood of having clogged ducts or narrow ducts and inflammation in the breast tissue is minimal. It's mostly when people are sort of driving or overproducing that leads to the inflammation that's there. Or exclusive pumping, for example, is also another reason, because again, it's sort of this artificial way of removing the milk that can be very harsh to the breast tissue, so it can cause inflammation as well. There are people that are more prone to it for whatever reason. They just sort of have, they're sort of the people that are more prone to overproducing in general. And so, I've had several patients that we've had to be very, very, very careful about any excess milk that they're producing, and really trying to keep it just as much as the baby is feeding, and that's it, and trying to keep as much direct feeding as possible. I will add too, mental health does play a role. I think that there is, if you're having a lot of anxiety or having postpartum depression or a lot of sort of OCD type things happening, that just increases the inflammation in the body in general. And so we have this sort of interconnected relationship that can happen that, then I tend to see more of breast pathology in people that are having mental health concerns happening as well.
Interesting. Didn't know that.
So removing milk regularly. So if you are feeding directly, then you're removing milk typically every 3 to 4 hours around the clock. Maybe you have one longer stretch overnight up to like 5 hours or so, but really you can't, and most people can't go longer than that overnight. Otherwise they'll get significant inflammation with that. Making sure you're feeding from both sides. like feed, meaning that you feed from one side, and then maybe if the baby, wherever you left off, then you start on the next side, that side the next time around. So trying not to just start on one side all the time. We always have one that's sort of a overachiever and one that's sort of like keeping up. And that's totally normal. But you sort of don't want to drive one to keep going, extra more than the other one necessarily.
Okay.
Nipple shields as well can also be a problem, again, because of the artificial way of sort of removing the milk. So if the baby is having a hard time with, and it may be also if the baby's having a hard time with latching itself, then that can cause issues with that inflammation as well. So sort of a host of things. But yeah, there's I think the biggest things are just sort of, if you're feeding directly and not doing any extraneous things, then that's the easiest way to prevent it.
Sure. Once we've like moved to mastitis, you've talked about like curcumin as and or NSAIDs at home that we can use for anti-inflammatory. Are there other supplements that we want to think about at that point? Like, because mastitis is actually like an infection, right? Where you're going to have a fever and things like that
So
with
that's
it.
a good question. So mastitis is not necessarily an infection. It's not necessarily a bacterial infection. It's inflammation.
Okay.
So bacterial infections don't happen overnight like that. Like, so we see quite frequently people will go from, sort of having feelings like, oh, they've got a little bit of, something going on. And then the next day feeling like absolute crap. They've got, fever, their body aches, all these things happening. And that's the systemic inflammatory response syndrome, or response to, this inflammation. But it's not necessarily caused by bacteria. So that, again, for mastitis, we don't treat right away for first line with antibiotics anymore like we used to. So the reason why antibiotics used to work, or why we used to give antibiotics, because we thought it was bacterial infection, but also why they worked, is that many antibiotics actually have anti-inflammatory properties themselves. So that is why they were sort of helpful. But now we just go with high dose NSAIDs. So if you have mastitis, we want 800 milligrams every 6 hours around the clock. I'm sorry, 800 milligrams every 8 hours around the clock, every 600 milligrams every 6 hours around the clock. One of those for the mastitis, and you'll do that for 24 to 48 hours until you sort of bring down the inflammation. Even if you have a fever, even if you have all the body aches, even if you feel like absolute junk, and also the ice as well. And then if the other thing that I can personally do to treat is, so if somebody is able to get a hold of me with who's got mastitis going on right now, I have a therapeutic ultrasound that we can use that helps with, again, bringing down that inflammation. And then I also, being an osteopathic physician, I also use manual therapy as well to try to help with moving the lymph and helping to sort of release that inflammation, so that then there's more flow, and we can kind of get that to settle out a little bit. So I'll use that as well.
Perfect.
So some of the Chiro for Moms can also help with that too.
Sure. Yeah. Well, yeah, you answered all my questions. So where do we find you? How do we get in contact with you? How do you help people?
Yeah, absolutely. So go to my website, www.fourthtrimesterdocc.com. It's FOURTH trimesterdocc.com. Yeah, so I'll see people for lactation consults, again, for mastitis, perinatal mental health, if there's concerns going on with that, or we do the fourth trimester packages where we see people postpartum in the home for all the well baby checks, all the postpartum checks, all the things. We see people typically about 5 times in the first 2 months, just to try to see, just to help with all the things, the whole transition through matrescence, right? And that newborn period. And then we'll also do the 2-month vaccines in the home if people want to do that as well. And then after that, we'll transition them to their regular pediatricians. And then I also have, actually coming up early next month, well, mid next month, I'm going to do a postpartum planning free workshop for people. So you can sign up if you get on my newsletter, go to my website, get on the newsletter, contact us there. Also follow me on social media, on Instagram. I'll be posting on there as well. So people can get that for free, which is great. But yeah, otherwise we care for folks in the Twin Cities. I've got several other physicians that work underneath me, that also are caring for other areas in the Twin Cities as well. So we sort of span a huge radius. So yeah.
Love it. Well, thanks for your time today. Thanks for the info. I learned a lot. I had mastitis twice. I'm like, I did not do any of those things. Great.
Now we know.